Folks, thanks for coming on with us today. My name's John Dubas with Premier Marketing, and we'll be spending the next 45 minutes to an hour or so discussing some of the means that are available for you to sell health plans electronically, specifically those that are pointed at the Medicare market. We'll be referring to different pieces of reference material throughout the presentation, and watch for that. That will come to you as part of the follow-up for everyone who has RSVP'd for today's presentation. Keep in mind today's presentation is being recorded as well, and then follow-up will include a link to the recording as it updates. We hope to have that to you later today or tomorrow. As a bit of housekeeping, if you have questions as we go through the presentation, please make use of the questions box in the GoToWebinar software, and we'll make certain that we address them if possible throughout the course of the presentation. And if they require additional research, we will get that information to you as well. A bit of background about our organization. Premier Marketing was founded in 1968. We're a national marketing organization that's part of the Integrity Marketing Platform with offices across the country. We act as an insurance wholesaler, offering insurance products through independent insurance agents with contracts available at the highest possible commission levels and recruiting contracts available to those who qualify. As I mentioned, being founded in 1968, that means we had a milestone in our history recently, our 50th anniversary, and we consider that a great accomplishment for what started as a small family agency in rural Nebraska that's grown into one of the largest marketing organizations in the Medicare insurance space. We do so through a complete portfolio of products, including Medicare programs such as the Medicare Advantage and Medicare Supplement programs and the standalone Part D prescription drug plans. We also have a full portfolio of life insurance and annuity products, including final expense life insurance with unique marketing programs for that, and pre-need programs as well. We also offer long and short-term care products, disability income programs, and ancillary benefits that include dental, vision, and hearing products, critical illness and cancer programs, and hospital indemnity plans. Those Medicare Advantage carriers include all the national carriers and many of the strong regional carriers that make a difference for you in your market, with that same philosophy carrying over into the standalone PDP space, where the national carriers are available to you through our organization. We do have a strong portfolio of Medicare Supplement programs as well, and unique marketing programs that help you be successful in that space. Watch for announcements of a couple of new entries into the world of Medicare Supplements. They're going to be big news for you here very shortly. When you look into the ancillary product field, in each of the categories, you have the leading carriers in that category available to you through our organization. These act as invaluable add-on sales for agents and for the prospects and clients they serve, because they help with those expenses that most base health programs have a need for additional help. When we look at the Medicare market overall, we're looking at a very large segment of our society. Everyone who comes on presentations like this hear about the aging of the baby boomers, where 10,000 people a day are turning 65 and one every 10 seconds or so. And if you look at that from a sheer numbers perspective, based on just age, it's not giving you, however, a true indicator of the size of the market, because some folks will delay entry into Medicare, the full benefit package, continue to work past the age of 65 and delay enrollment into Part B, and you'll see that number decrease a little bit based on age, but you see it increase massively when you consider about 1/6 of the Medicare population is under the age of 65 and are accessing benefits because of disability. So we have a very diverse population when you look at the Medicare population overall. You have some challenges to the health. The average Medicare beneficiary, well, 2/3 of them have 3+ chronic conditions, and many of them also have some challenges when it comes to their wallet. This particular number is based off of the Kaiser Family Foundation analysis for 2015. A later number in 2017 shows us the income on a median basis at 26.2. It's not a huge increase. And so what we have a dire need for is a full portfolio of products that can serve such a diverse population, and then tools to help deliver those products to our prospects and clients and make it a compliant and easy sales process, as easy as possible. And so we endeavor to do just that. Because when people enter into Medicare, they have different choices. A sales manager I had years ago with Prudential used to tell me that a decision to make a decision is a decision. And when someone enters into Medicare eligibility, that's a decision what they do from there. Are they going to pick up the optional Part B coverage? A good portion of segments of our population choose not to. Are they going to then self-insure if they do pick up Part B for the rest of the medical expenses not covered by Medicare, or are they going to self-fund the Part D, the drug coverage as well? We see that many folks will decide to take a flyer on the medical coverage and pick up the prescription drug coverage. What we have, however, are much larger numbers of folks who will decide to help cover those gaps in their medical coverage through either a traditional, modernized, standardized Medicare Supplement program, a Medigap plan, or another portion will go into the private arena where they assign their benefits to a private vetted insurer and partake of the Medicare Part C program in that space. So what we have is a diverse population. Knowing where they are and how to reach them is paramount to our success in this area, and helps us with the different marketing programs that we develop to reach the population. What we see when people do enter into Medicare, note this is a initial Medicare enrollment, so it takes into effect the folks that are aging in and the folks that are late to Medicare as a senior, those that have picked up Part B later, that it's almost an even split in the choice of where they're going to go for that extra coverage. You have 41% looking at the Medicare Advantage programs and enrolling in a carrier's choice in that arena. 43% look at the traditional Medicare Supplement programs and go that route. But you have a portion that also stays on original Medicare only. And that doesn't mean they only have Medicare. That may well mean they have retirement coverage, or they're getting assistance through another governmental program like the VA or Medicaid, or a number of other reasons why they didn't pick any additional coverage that falls into one of those two categories. So having this information in our pocket, in our head, gives us an idea of some additional routes that we can follow in order to get in front of qualified prospects for the programs that we offer. One of the things we see in Medicare, however, is a language somewhat all its own. I have a brother-in-law that, well, I had a brother-in-law that has works in the computer field, and that's a language all to itself. Many folks, when they visit with us about Medicare, they say, hey, how can you understand all these acronyms? And in many circumstances, no matter how long you've been in the business, sometimes it helps to have a cheat sheet that helps you translate. This will come to those that request it. It's a large document. Otherwise, it'd take the entire email follow-up just about to send it. But if this can be of use to you, watch for the follow-up that comes and respond and ask for this, and we'll send it to you so you have this little translator device. The folks that enter into Medicare have different standard election periods that they have to follow, and they have what I refer to as get-out-of-jail-free cards. We're still in the OEP process that's designated as the third standard enrollment period, where a person in the first 3 months of the year can switch from plan to plan within the MA world, or drop the MA plan and go back to traditional Medicare and pick up a PDP program. But these additional steps, and there's another one that's Mother Nature caused, so to speak, because of the hurricanes. These are special circumstances where an individual can change coverage throughout the course of the year. I'm apologizing. I noticed that still says 2019 on it. That's 2020. It gives you an opportunity to be very active year-round. What we've seen statistically is about 40 to 50% of the population makes their choice each and every year during the annual election period. About half the population in the intervening time period will switch throughout the year or pick up a different type of coverage. So you have the folks that are aging in, you have folks that are moving from one service area to another, folks that might have special exceptions because of monetary constraints, a number of different reasons, but we see those as the most common reasons for a person to be able to exercise a special election period. That gives us then a bit of background on how we approach today's topic and look to sell these programs electronically. Our most valuable resource that we have as insurance professionals is our time. And it's a limited resource. It's then a question of how you're going to spend it. Most folks don't want to work 7 days a week, so they'll take off some time on the weekend. We all need to sleep a little bit upon occasion, and some of us eat. Some of us eat too much. But that gives us a certain number of hours that we can use to pursue our careers and our passion for aiding this demographic. So we need to make certain that we are looking at building our means of reaching this population and perhaps trying something a little different than what we've done in the past. So I'm asking you with this particular slide to be open-minded. There are some of us that are more adept at different electronic processes than others. I will confess I am far from a computer programmer, but there are certain electronic devices I can figure out. Somebody hands me the right remote, I can change the channel on television. If it's a chocolate bar, that's a little hard for that to work. So keep in mind, part of the reasons we do things with Premier Marketing is to enable tools that give you a means to operate efficiently, but as simply as possible as well. That's possible in the insurance world. So I'm going to give you the good, the bad, and the ugly of these different situations. I'm a big Clint Eastwood fan, if you can't tell, and that's a great movie. To begin with, a lot of our possibilities of expanding our portfolio of products begins with contracting. And we see many companies now, different carriers have gone to a paperless contracting system. And with many of those carriers, it requires a direct link from that carrier for us to initiate and complete contracting for that particular company. What we've done is also procured software that as you look at different companies and consider contracting with multiple organizations, the program here, Assurance Bay, allows you to create an agent profile. It stores all the information that you have on yourself that's required for an insurance contract, including answering the background questions, supplying your E&O information, that sort of thing, and stores it for you. It then gives you the opportunity to then electronically fill many of those contracts. For those of you that have gone through some of the carriers who keep the old addendums from the past as part of the contract because they want to make certain they document what they paid for something at a particular point in time, this can be really helpful so you don't miss one of those pages you need to initial or struggle through an 168-page contract. They'll autofill for you. Now, there are a few companies that don't interact with this system, but a large number do, and it's a great way for you to do some things once, invest a little time initially, and then work through it to pick additional carriers so it'll autofill those contracts for you and give you updates. It allows you then to go in and create your account. It's really simple. If I can do it, you can do it. and you go in and basically give the details about who you are and what you're looking to do with a secure function with password encrypted software. It allows you to make certain that you see the different programs that are available to you. And since there are a number of marketing organizations such as ourselves that use this system, you may see multiple opportunities to access it through multiple organizations. It's important that you designate the particular organization for a particular contract in order to have it work correctly. It gives you the user ID and all the details you need in order to stay secure with the program. That's really an important piece because part of what we put in this profile is our financial information, not so much a tax return, but bank account information for the drafts from the different companies to go directly deposit within your account, and we want to make certain that that's held secure. It gives you then the different opportunities to go in and adjust your profile as it changes in the future and select the different companies with whom you look to contract. And there's a very large list of organizations that encompass that number. What also happens is as we put the contracts in play, it's important for us to have the information about the companies and the programs in order to be able to present them knowledgeably and compliantly. So we have different webinars such as the one being conducted right now, but also contacts with the different carrier-specific webinars and not just sales training, but product training and marketing programs are laid into this system as well. And so what you'll see is an opportunity to access not only future presentations by RSVPing for additional information, but also a listing of the past presentations with the link to the recording, and they're on our website and on our YouTube channel as well. So you have a number of different types of topics that are available for you. And as you go through and select the different carriers that you wish to work with, it's important that you have all that information and access their trainings specific to their organization as well. I've been involved in the Medicare field for much longer than I care to admit now, and it's important to realize what we know and what we don't know. And having access to particularly programs where the benefit might be delivered through a network, having that information for our particular market is paramount to our success, not just to make certain that we're doing things correctly, but also to potentially identify different marketing opportunities. The government does step in and help with training as well. The National Training Program from CMS delivers some really nice pieces that can help us not only become familiar with different programs within the Medicare and Medicaid arena, but also gives us the opportunity to make use of the PowerPoints that are included in this software, in this program, that give us a sales track to follow in our dealings with the public. In many circumstances, one of our most valuable resources in reaching out to the public at large through centers of influence in the community are Medicare 101 trainings, basic information about the Medicare program overall, or one of the components that are put into play to help with the shortfalls of the base program. Medicare supplements, prescription drug plans, Medicare Advantage programs. There are courses and PowerPoints within this site that give you access to those presentations and is a great sales track to follow and work with the community. If you are interested in those software programs, obviously you can go to this site and register and find them and get them yourself. I do have them downloaded and will follow up with anyone who requests those informational programs as well. It's also important, as I mentioned, to make certain that we take advantage of the trainings with the different carriers that come into play. And I got to tell you, some of them are a little better than others, but they are very extensive with the different trainings that are available. Some of these companies really have it down. You also have the opportunity to access them on a live basis. Many of the companies stage live events if you prefer that sort of access, or doing things with webinars with the companies. This is an illustration of a couple of those with different carriers, UnitedHealthcare, Humana, that sort of thing. Once you feel comfortable with the product choice that you have and the training that you've put into play, and keep in mind, training is like exercise, it's a constant activity, you then need to make certain that you have the electronic tools available to you to properly present some of these programs. Many of the companies have different PowerPoints or presentations pre-recorded in many circumstances where they'll supply a video for you for part of your presentation. But for those that have been involved in the Medicare space for any length of time, they realize that if they're going to pursue Medicare Supplement plans, it's important to know what premium is, how different companies stack up against each other with different plan types, and what would be a good marketing tool to do an analysis for the public, for the prospects and clients that we have on the books. This is a software tool that we contract with that's made available to our agents, our contracted agents at no cost through CSG, and it gives you a number of different programs that you can use and systems within the program to quote effectively. The Medicare Supplement tool gives you not only a way of helping you define what might be the most competitive carriers in your particular target market, so it helps you determine that question we had a little bit earlier as to what companies we work with, but it's also a great way to offer a complimentary Medicare Supplement review, a great way of helping folks have the information they need to base a decision as to what might be the best Medicare Supplement program for them. It also gives you a means to do so remotely, because it does have an e-app function as well, and a way of dispensing that information to folks electronically, or for those that carry a computer or another electronic device into an appointment live on site, or old school, it does allow you to print out the quotes, obviously, on paper as well. When we work in the Medicare space, even if we're concentrating on Medicare Supplement programs, many times a decision to offer a full portfolio will require an additional amount of compliance documents that won't be necessary in just the Medicare Supplement space. But if you have a person who's looking to compare Medicare Supplements with Medicare Advantage plans, or asking for additional information about standalone prescription drug programs, it's important that we have the option of procuring and securing the scope of appointment that's necessary to set the range of discussion that you have with your prospects and clients ahead of time. The rules on the scope of appointment have changed throughout the last couple of years. It's important that we no longer have to justify a scope that was obtained right before our presentation, but it is still necessary in that space to have a scope of appointment signed and in play before we begin a discussion on those topics. This allows you to procure that document electronically, and almost as important, secure it for that required 10-year period where the government's asking us to hang on to that whether we sold the person or not. This gives you that capability to hold it in a very secure space, password protected in an encrypted program. It also gives you, as I mentioned before, the opportunity to complete e-applications as well with many of the programs. There's a few carriers in the Medicare Supplement space where it takes you basically to their proprietary e-app on their websites. but it gives you an opportunity then to complete that process in a paperless fashion. It also gives you the opportunity to then cross-sell. You'll notice in the 3 other product categories that we have here, the final expense, hospital indemnity, and dental, if you're in there on a Medicare appointment, and it's not just Medicare supplements, well, you can sell 2 of the 3 on the same appointment, but final expense requires that 48-hour cooling off period to come back and present that program. For folks that deal with the Medicare space in certain markets where that market is dominated by 1 or 2 carriers, and the folks are very happy with those programs, in many circumstances, a face-to-face presentation at that time then, well, you'll walk out of the house without a sale unless you got a plan B. What you can do with this program in the Medicare Advantage PDP selection is pull up a particular plan in a particular market that that person may well have in place. As you discussed, you determined what it is. They don't want to change. But if it's a Medicare Advantage plan, most of the Medicare Advantage plans now have some fairly significant daily hospital copayments or a single stay copayment. This gives you an opportunity to fill that with a hospital indemnity program that the system will help you coordinate and give you the option for multiple carriers in order to do so. It also gives you the opportunity to layer on that dental program, which I tell you, no matter what their base health program is, if someone needs dental work, they don't have extensive enough coverage in their Medicare Advantage program in most circumstances to take care of that, and you get maybe a discount on certain Med Sup programs, very few of them, in the dental world. So it's a great way for you to have a piece of electronic support that's going to help you sell across the board. It will give you also some of the base information you need for final expense cost. That would be a second appointment in those circumstances. It's very simple to work. One of the things that you're going to get as follow-up to today's presentation is a link that demonstrates the use of this system extensively. We do it today, but it would take too long. And it also gives you how to use the e-app and that scope of appointment as well. So you're going to get some information on that process with the e-app and the scope as part of the follow-up. That whole concept of making certain that we have the scope of appointment, it's important for us to realize that, yeah, it's a compliance requirement, and sometimes it can be a bit of a challenge, but using a scope of appointment appropriately allows you to basically preface the need for cross-selling, because it lists those different programs that can be offered during that singular appointment, and it gives you the opportunity to at least do the Columbo close. That one question of, hey, just one more thing. What do I need to do to make certain that we cover this additional product? Do you have enough dental coverage? You never have enough dental coverage. So it's a kind of an attorney question where you know the answer before you are actually asking it. So this gives you the opportunity to give you that additional choice of that additional chance of getting the people that the products that are necessary for their needs. The government does give us some help as well when it comes to electronic tools, and many agents have used the Medicare Plan Finder for years in order to help people with their Medicare choices. In this circumstance, we had some challenges this last EEP with changes that the government had in the system. Quite a few bugs came into play. It is, however, a piece of the puzzle for helping determine what might be the best fit. And the general public does have some confidence in CMS, particularly when they have help guiding them through these systems. So they have a number of training programs on that same site that I referenced earlier, the National Training Program, that allow you to walk through and look at how to use the plan finder. I know that might sound simple, but because of some of the changes over the last year, we have differences in how the plan finder works, and it's necessary to get a good working knowledge of that system if you're going to use it, because the lists that were in there in the past are not there that you can reference. The government gives some suggestions when they rolled out the program in anticipation of the change in the software and the vendor that delivers that software. I have personal concerns on how some of that works, but there are ways to make it work for you if that's the route you choose to go. But even if you do, keep in mind it's not a true sales tool, and we need something, a software system that will help us with additional functions. So in order to cover some of those plan options, we're looking for a program that will give us easy access and use. It'll satisfy all the compliance requirements. It'll compare the coverages that are available. It gives us the chance to import the different changing parameters that are part of the Medicare space with formularies subject to change all year round. It also allows us to customize that to the beneficiary circumstances, give us a chance to get information to the beneficiaries ahead of time so they can do their own research. The younger of the Medicare population are really into that. We also want a piece where it allows us to store that past information so we can do annual reviews or go back to the people that we have permission to contact with that we didn't enroll and represent year over year, and do so electronically with time savings and a savings of effort. These programs are justified in many circumstances because people shop differently according to their age, and they have different requirements in their own mind that need to be satisfied for them to make a choice. They would like these to be personalized options where they can see the physicians and providers that they actually access. They want to have a specific quote with their medications, much like what we did for years on the plan finder, where we're able to then compare the programs and come up with an accurate cost estimate and view some of the things that are affected by their general health circumstances as well. Because they don't look at just premium now, they look at out-of-pocket cost, and there are many variables that come into play when it comes to that decision. It's also very important that we utilize the systems to make certain that the all-important drug component comes into play. Remember the slide early in the presentation that said, okay, choice, the decision to make a decision is a decision. Some of these folks are only going to pick up a Part D program. And we find many times that Medicare Supplement agents don't necessarily care to deal with PDP choices. They'll just send them to Medicare.gov and let them work through it. Well, this gives you the opportunity to close the door on your competition, provide a valuable resource for your prospects and clients, and actually use that as a hook into the systems that give you the opportunity to visit with people about a very important coverage, their drug coverage, and store it year over year. You personalize that, and when you are working with those drug programs, it helps you with the engagement of your prospects and clients. You have a higher appreciation of your services that you're rendering, and they are seeing the piece of information that comes into play. This is an important component that I kind of referenced a little bit earlier, where utilizing systems like this really helps the trust of our prospects and clients, not only in our services, but in the carriers and the overall system. Being able to utilize our interpretations of the data that is given is important because, well, that's what bases a sale versus a non-sale. And it helps us by utilizing that information to once again close the door behind us and keep our book of business. Each and every year, as a commissioned salesperson, we have and the amount of money that's going to come to us through our renewals. We're in this business for the long haul. And this is a way to make certain that this salary of sorts stays with you year over year. So at Premier Marketing, we've decided to engage in the system offered by Connecture that we have labeled Medicare Center. It allows you to go in and visit with people that don't necessarily want to meet face-to-face. There are some people that, hey, meet me at McDonald's for a coffee. They don't even want to do that anymore. You also have the folks that, well, they're one of the few that don't make the decision right at the first of their enrollment period. They procrastinate. Or you're in an area where Mother Nature comes into play. Here in the Dallas market a few years ago, we had a massive ice storm the last week of AEP. The first week of December, we were iced in. You couldn't move. You don't see that very often in Dallas, but it happened then, and there were people that had some tough consequences brought on them by Mother Nature. There are also folks that service a large geographic area or may even market in multiple states. And so you're minimizing windshield time with the use of some things electronically, and it gives you an opportunity to market effectively electronically across multiple states. So you're going to look at a system like this because it allows you to streamline the sales. It gives you the opportunity to show the plans with whom you're contracted. It gives you an opportunity to compare multiple plans side by side compliantly. It allows you to work both the Medicare Advantage and prescription drug markets and render those electronic comparisons to your clients quickly and compliantly through secure emails. It also has a system within it, like the CSG system for the Medicare Supplement programs, where you can procure those scopes of appointments and secure them for that 10-year period and also enroll remotely as well. It gives you then an increased retention rate. You're driving up your persistency because all that data is there for you to do a year-over-year review. It also gives you that opportunity, as I mentioned before, to go back and visit with folks that didn't buy from you in the past for one reason or another. So you are creating a set up pool of additional prospects for yourself by utilizing the system and maintaining the client relations database within this system as acting as a CRM for you. It also gives you then the opportunity to use that data throughout the year as part of a cross-selling process where you can go back to those folks and through use of some of the other tools that we're going to visit on very shortly, that you will have the data necessary to offer additional programs. It has three important components in it. It gives you the opportunity to use the Plan Compare program, which lays out the documentation, the information that's necessary for that prospecting client to have ahead of time before the discussion, all the material that normally you would deliver as part of a packet. It gives you then that comparison with cost of ownership estimates. It gives you that opportunity to do the application remotely through mobile devices or your desktop or laptop, and it helps with the processing of those applications because there are many of us that like the old tactile paper, want to fill out a paper app, want to submit that. Well, you've got some compliance concerns that come with that, but you also have a challenge with a very base communication process. Years ago, when I was the regional for a special needs program with a carrier, we had 80% of our applications pended because processing had a challenge reading what we wrote. Our handwriting in many circumstances, well, it looks like a chicken in heat. It just doesn't always come across the way it's supposed to. What you have with an electronic app through this system or any system that are part of this process, it allows you to get that application completed thoroughly because you can't submit it with a question missing, and it allows you to do so cleanly, which speeds up the enrollment process, which in turn, for most of the year, speeds up how quickly we get paid. I put that caveat on there because obviously during AEP, the government, in its infinite wisdom, doesn't allow us to be compensated for our Medicare Advantage and prescription drug benefits for the first of the year until after the first of the year. But this is a great way for you to enhance your cash flow in that circumstance as well. It also provides for you a microsite with a broker-specific URL, a PURL. And this is a tool that's enabling you to put a link in your communications with your prospects and clients that they can go remotely and do some shopping on a site that is yours, basically, where if they enroll through that site, it's tied to your agent number with the different carriers, and you're credited with that sale. It's a great way for you to drive business in that fashion, particularly through electronic means of communication, but it's a great way as well to make certain that all the necessary material be distributed ahead of time and collected thereafter compliantly. And you'll have a space on the World Wide Web. Some of the other things that the system does is it gives you that different drug compare that allows not only a comparison of the medications they're taking, but perhaps different therapeutic alternatives utilizing their formulary, the plan design, drug cost, the source that's already in the plan they have to drive down their cost as well. When we look at some of the costs of the medication that folks have to take and the year-over-year cost increases of those medications for heaven knows what reason, we see a constant upward trend in the cost of medications that have been out for 40 years. This gives us an opportunity to not play doctor, but not play pharmacist, but give them some options that they can utilize and discuss with their providers to see what would be a cost-effective way, as cost-effective a way as possible to control that condition. It does also allow us to make certain, because these are updated constantly, the formularies, that the drugs that they are looking at are part of their program. It allows also an opportunity for us to make certain that if there are preferred providers in that network, that they're utilizing them as well, and give them an opportunity to figure out where they are, and also search for other providers within their plans to identify if they're in or out of network, or if there's a need for a new specialist, how do we find out who they are and where they're at. So some great tools in there that give you an opportunity not only to help with the initial sale, but also with periodic changes in circumstances through the use of this tool. It also helps you to auto-populate each and every year. So it'll carry over, and you can then on your annual reviews go back and visit with that either prospect or client and ask for an updated list, going through what you already have in the system, minimize some of the work you have year over year in creating those quotes. A great way for you to speed up that system. It also gives you an opportunity to send out just the information that's necessary for enrollment. These are for folks that you've already supplied the material for that program, and all they're looking to do is enroll. This is for the folks that aren't a one-call close. You know, it's like, hey, I want to think about it. Can we enroll in the future? And it gives you the opportunity to follow up, do so electronically, and avoid a second trip clear out in the country if necessary, or give you an opportunity thereafter to get the enrollment, give them an opportunity for them to get their membership information, and then pursue an additional, pardon me, I had a question flash past, additional information on other programs that you offer. Some of the things that are influenced by this program is we did see an increase in the MOOP year over year for the medications in the Part D, and the government has put in a lot more flexibility for MA plans, particularly to offer non-primarily health-related programs. the catchphrase of the social determinants of health. And we're seeing some really unique programs in that area where there's actually a carrier in Texas, and in Central Texas for a chronic SNP plan, they have an air conditioning benefit because it's found that the heat will trigger COPD incidences. So it gives us an opportunity to make certain that we are addressing some of the changes in the program and the different pieces that can come into play with the use of the system. So once again, we're using a program to help make us more time efficient and effective in procuring and submitting our business. And there are 3 ways that you can submit the business using this system. You can do so face-to-face, where you're physically with the client, enrolling online using a laptop or a tablet. You can do some things with telephonically as well, where you've sent out all the product information and that scope of appointment information in an encrypted email, so you're safe. You can conduct then the explanation of those programs and get them an application link to complete it on time. Oh, pardon me, a little flashing there. And then, of course, there's that public-facing website that we discussed earlier that is tied through your personal URL, a great way as a outside source that you can send them to for an enrollment as well. What it does is it gives you the opportunity to grow your book of business in the Medicare space, particularly in the Medicare Advantage and the prescription drug world, by focusing on the experience where you're satisfying the needs of your customer by doing a detailed program specifically for them, and being an expert when it comes to that all-important medication coverage. You have all the data that's necessary in order to make certain that you're satisfying their requirements in that area. It allows you to be so much more efficient. It saves you time, which, once again, going back to our most valuable asset, it gives you that opportunity to make certain that that extra time, well, it could be extra sales, extra time with your family. Whatever you designate that savings of time for, it's going to be there for you, because it also helps you retain the business that you already have into place. Your retention goes up, your persistency is much higher, and it doesn't cost you anything as a contracted agent with Premier Marketing. So you got a nice round number when it comes to what do I got to pony up. For those of you who have been active in the ACA space, remember the first year when those programs were available and the computer site at healthcare.gov cratered, and you saw the cottage industry of all the outside private companies with their enrollment systems where they charge so much per app. Well, this takes care of that. Because even if you are concentrating on the Medicare Supplement world, in many circumstances, it goes into a discussion of other product. And having that product available can make all the difference in the world in not only the delivery of the information that you have compliantly, but also vastly increases the opportunity you have to procure a new client with a new sale. You have also additional electronic applications made available by the carriers themselves. We have a listing of them that are available. It's a very large document as well, because we try to put the systems in there so you can access these different electronic apps. And with the number of carriers that we have to go through that individually, well, it'd be even a longer presentation than it already is. So we've selected a couple to be basically a guinea pig for you. You have United System, their lean program, that is the system they use for their Medicare Advantage, prescription drug, and Medicare Supplement programs through AERP. And it is a program where they supply you different electronic aids so you can use that program easily. They have different training videos that are pre-recorded so you can go on and go through that process on your schedule. They have them live too, obviously. Sometimes that's helpful to hear the back and forth discourse, but it gives you the opportunity to have those tools that can help you not only with that enrollment tool, but if you're one of the agents that are engaged in their different marketing systems, particularly their retail program, access to their Be Connected lead system, it helps you with that as well. It also gives you the opportunity to complete that health assessment survey that they make available. It's a service that you deliver not only for your prospect and client, but also for UnitedHealthcare or any of the number of other carriers that have this as well, where if you complete it utilizing the lien system, they compensate you for that service. They have this available basically across the country. What we see with some other carriers is they may offer it, in specific areas as well. It gives you an opportunity to use that and complete that system within that lien system. It used to be two different ways you had to do it. They've improved it, so now it's a simpler way of doing it. If you're one of those agents working in the Medicare Advantage space and you don't take advantage of the health assessment programs, completing them and driving that information to the carrier, I'm going to say this, shame on you. You're giving away money, and what you're doing is you're engaging data going to the company that helps them maintain benefit structure. What we're going to see in 20 and 21 are some challenges in the payment to these Medicare Advantage programs, which when you take into account Medicare cost ratios going up as they do every year, it gives you the opportunity to help maintain better benefits, plain and simple. So it's, yeah, you're doing United or one of these other companies a little bit of a favor. They're paying you some for that, but it also gives you the opportunity to help control some costs within the system. The carriers also offer different toolkits with which you can utilize to access different marketing material. United's toolkit is part of their Jarvis site, and it's an awesome piece. I don't mean to go on and on like I'm still a UnitedHealthcare employee. I left that company 10 plus years ago, but they have programs in here that help you market their different programs, and it includes some generic material that we can use as independent insurance agents for these programs. This is becoming much more common within the Medicare Advantage space. The Aetna system is wonderful. They have some different things that they do when it comes to populating some of the documents that are different than UnitedHealthcare system. But hey, Anthem Blue Cross Blue Shield has their own system to do it. Humana has their own system to do it. They are offering this type of marketing support electronically that gives you the opportunity to personalize that information, make it available at the cheapest printing cost available, doing it ourselves, and using it either in that fashion or as part of an electronic communication. So it's a great way to use carrier-specific and in many circumstances generic material with a number of the carriers available and get our point across as well. One of the things that you'll see in different areas with different companies too, particularly when you deal with companies like Aetna that have a portfolio of products that include some of these ancillary benefits, United doesn't do that with the Medicare contract. With Aetna, you will see that they offer a dental vision hearing program, a stroke, heart attack, cancer program, or a heart attack, stroke, cancer program, hospital indemnity programs, short-term care plans, different things that you can use a tool that they provide to help you quote their systems and enroll in multiple programs and filling out the application simultaneously. So you're utilizing a system to cross-sell accurately and save you time from within these different programs that are available with the carrier. Aetna's really strong with it. Cigna has a great program with it. And Aetna also has that health assessment available. It too requires the use of their e-app through Ascend. Centene Allwell has the program. WellCare does. There's a number of programs out there, Anthem, that have these systems. And why would you turn away a Benjamin? Well, no, 50 is a grant. Why would you turn that away when it's there for you just to do a few more questions and serve the general population? Some of the other things that we make available at Premier is the use of an agent portal where you have access to your information behind a wall, where you can go in and register and pull information that's not available to the general public, and specifically your information. This is also where the Medicare Advantage and prescription drug year over year, pardon me, I keep flipping through stuff, year over year benefit changes are available as well. When the companies announce the next year's benefit structure in those products, it's generally in July, we can see them as contracted insurance agents. The general public cannot until October 1st. So this is where we can procure that information quickly and make certain that we begin planning for the next year's sales as well. Doesn't mean we quit selling in July for August because we got bills to pay anyway, but this gives us the opportunity to start planning the course for the future. Some of the things that we look to recognize that are necessary in an overall electronic approach are the use of agency websites. We visited a bit about the personalized URL in the Medicare Center program. That's not a true website. That's a microsite specifically for an enrollment process. There are a number of organizations out there that make online marketing services part of an entire system. And if you choose to invest your dollars in such a fashion, this is one of the good places to start. One of the things that I will find curious about our organization is the mothership recently purchased a marketing company, Thomas Arts, so we may have some different things roll down the line in the future in this area, but these are great ways for you to drive your visibility and recognize that many people are shopping electronically. Many people want to do business in that fashion, and these can be very helpful for you. You can get a site pretty inexpensively, $40 a month, on up to thousands of dollars a month, depending upon what you want that site to do. This is one of those circumstances that if you're a larger producing agent, you might want to dive in, or you might just take it a step at a time. And this is the system that can help you do so by starting with MedSups. There are also different ways of communicating with your book of business, and that in many circumstances, well, it requires calls, obviously, to your book of business, but many times communicating in print can be very helpful. In the old days, that meant using snail mail, the United States Postal Service, which can be a challenge and can be pretty expensive in the long run as well by doing mailings to your prospects and your clients. It's still a great way to prospect. It can be a great way for you to stay in touch with your current book of business, but it's one that if I use snail mail, I would do it for birthday cards or holidays. For constant communication, I would develop an agency newsletter and stay in front of my folks. They remind them who I am, what I do, and it gives you the opportunity to use these tools we're talking about and cross-sell throughout the year. It's also a great way to keep your retention up, drive your persistency. And many times that entails the use of a good list. Much as we move, we age, we change email services, email addresses, our phone number perhaps, it's important to make certain that we maintain our lists. So that requires perhaps the use of a CRM to generate that list and keeping up with that data. That is a mindless administrative task that can be outsourced to high school students or administrative staff, if that's something you have. But it's a very important component to make that agency newsletter consistent. It's also a piece that gives us the opportunity, because we realize how much time we're putting into the system, that in order to maintain its value, we need to keep up with it. There are a number of programs that allow you to send these email communications through electronic functions. And you can invest in this area too, should you choose to do so. Some of it will come with packages from companies that offer the websites. Some concentrate just on a CRM and the communication pieces that come with that. As part of today's presentation, I have a number of articles that will come to you that will give you an idea of what might be best buys in these areas. It's also important that you work through different mediums. So if you're comfortable with working social media with the little videos that a whole bunch of agents seem to be recording in their cars they're driving, but video enhances the likelihood that someone's actually going to read or get the message out of your communication. So let the videos talk to you, talk for you. You can be nice, short little messages. It gives them an idea of how things change over time, obviously with the two pictures of this schlub at different times. But it's a great way for you to get your message across and create your identity with your book of business. And you do also have opportunities to do meetings such as this with your prospects and clients. You can create webinars as well and go virtual in instant meetings through systems like Join Me or some of the other pieces where it doesn't cost anything for it to come into play. So we'll get that information out to you as well. When you market yourself digitally, one of the first things that people think about are social media. Hey, am I on Facebook? Hey, what about LinkedIn if I'm a recruiter or looking for prospects in that area? It's important when we do some of these programs that we have an idea of the do's and don'ts. I keep bumping a button here, pardon me, and it keeps bouncing us. It gives us the opportunity to utilize these systems. If you're going on Facebook and you're looking to market just to the people you know, well, you can do it with a personal account. But if you're going into Facebook and you're looking to purchase ad time, it's got to be a business account. So you will have that information available to you through some additional trainings that we have as well. There are a number of different platforms that come into play, Instagram, some of the other tools that are out there, but it's a great way to engage people and keep them on the books as well. And depending upon the platform you're using, you will see different age demographics influenced by them in those circumstances. Some of the other things that we'll deliver for you is the opportunity to make certain that what you're doing is a protected activity. As an insurance agent, for most contracts now, we're required to supply information about our errors and admissions coverage. This program allows you to pick up errors and admissions coverage on a discounted rate that covers you regardless of who your upline is. There are a few agents that will put all their business through one marketing organization. We'd like to be that organization for you. But we realize in many circumstances, some folks feel it's best to move or have their business with different marketing folks. This gives you the opportunity to be protected regardless of whom you contract through. It is a solid alternative to some of those organizations that will put you on their blankety-no for this policy that you have with them, and you're left hanging in the wind for the rest of your offerings. This will take care of you in those circumstances. We also want to make certain that we help you keep your license in play. So we bundle and discount different continuing education programs through our association with WebCE, and we help you pump up your own benefits structure as well with a non-cancelable DI program that's modified guarantee issue, discounted rates, and you share the commission. So it's a great way for you to protect your own income as well. As I mentioned earlier, We do a number of webinars on different topics and give you the opportunity to view them 24/7. They are available on our website and on our YouTube channel in a repetitious type of tone there. We also want to make certain that you're getting the full compensation that's available for you through the different organizations with whom you contract. So the different carrier trips and incentives are listed here. In many cases, that production also helps you qualify for the Premier Producers Convention. You'll see that those incentives and trips never include Medicare Advantage and prescription drug programs. Why is that? Well, the government standardized the compensation for that, so it makes that non-compliant. This year, our trip is a cruise from Miami to the Bahamas. They're about to roll out additional information on the next trip, so watch for that. We do help you with different lead programs. In the Medicare space, you can cold call for Med Sups. You can't cold call for Medicare Advantage or PDP programs. Sometimes it's helpful to have a list regardless. We can help make that available to you at a discounted rate, butted up against the do not call list, or complimentary based on your contracting situation with our organization. Many folks like to do community-based programs and establish themselves as a subject matter expert in their target market. We have programs designed to help you maximize those efforts in your community. So the different retail marketing programs, yeah, they're really hot during AEP, but I got to tell you, they're a year-round opportunity now. Well, there are folks in Walmarts now. They aren't in there as many times during the week, but that opportunity remains there for you. Different carriers have their own systems with different vendors in that area. We have systems in place that can help you be effective in that space by making that basically an office outside your office. You know, if your office is your car, a great way for it to work. We have also different programs that help you access and utilize the centers of influence within your community, faith-based organizations, how to approach them, some of the things that are available as activities through those organizations, be it seminar selling or camps within a particular location. And we have different programs that help you with provider marketing. We did a webinar on that earlier this week. I'll include the link to that in the follow-up that we send out for today. When you work and establish a relationship with a carrier, it not only helps you become more comfortable with the product that they offer, but it also ingratiates yourself to that organization. They realize who you are, and they may be able then to help you with carrier-generated prospects as well. There are unique marketing systems with some of the carriers. America comes to mind with their social media program, Mutual of Omaha with their unique marketing support programs. There are different ways to utilize some of the carriers that you contract with in order to make it effective for you. We do also offer internet leads. Facebook leads are a very solid way that Final Expense Division has demonstrated that that'll work for you. If you are active in the final expense space, please make certain when the follow-up comes out to you that you say, hey, John, give me information on the final expense program with Facebook. I'm going to tell you, I'm not the subject matter expert in final expense, but we have some very quality people within the organization that will make certain that you get that information from those individuals. We do still offer direct mail support based on production. We deeply discount the costs of those mailings to you. There are programs in the Medicare space, and there's also a program in the final expense space. They're independent of each other, so you can utilize production in both areas to get even more direct mail support. As you can tell through what came out to be a longer presentation than I had hoped, we want the opportunity to work with you, and in order to do so, it requires a decision on your part. Do some of these programs help you with your personal marketing program to be a more effective, more efficient, and more productive agent? If so, it's something we'll work on to make certain the contracts are in place in order for you to access the programs we offer and make certain that you have the information in order to make them work. It brings up a line in a John Wayne movie, The Cowboys. Basically, we're burning daylight. Let's get it rolling. You can reach any of us here at Premier Marketing through our toll-free number, 1-800-365-8208, or through our website at premiersmi.com. Keep in mind, we are going to attempt to reach folks that are on the webinar or have responded to it with communication, and make certain that we cover any questions that have been left unanswered in this presentation. Luis, we are going to reach out to you, so watch for that call. This information gives us the opportunity to discuss some things that can be key components in the success of your insurance agency. We want to be an asset for you and look forward to the conversation we have in the very near future. Until that time, watch for the follow-up we send out, and we wish you good selling. Thanks so much, and we'll talk to you soon.